Today we're going to inject Tony's tennis elbow with a product of hyaluronic acid known as SportViz. The first thing we need to do is locate the common extensor origin. This is the main point that most patients with tennis elbow feel pain. So how you do this is you find the lateral elbow crease, take your thumb down and then go onto the lateral epicondyle and rock your thumb over and onto the anterior facet of the lateral epicondyle. This is where your patient will probably tell you they feel significant pain. You can confirm you're on that tendon insertion by getting the patient to do resisted wrist extension against you. So if you just pull your fingers back against me, okay, and you can feel the tendon contract against your thumb. Okay, so once we've located the common extensor origin, I'm just going to demonstrate how you would approach marking the patient and injecting the needle into the patient. So firstly, you need to select a needle which is an appropriate size for the patient. When you actually come to administer, you need to clean the skin, but we're just going to mark the patient now onto that common extensor origin that we found with the tendon, with the needle sheath. So just can mark that point. Okay, and when we come to inject, you take the needle in at 45 degrees to that point and insert down onto there, and then retract a little as you take it round and insert, and as you retract the needle you administer 50% of the medication. As you take the needle out a little bit further, you then rock around through an arc of about 180 degrees and insert again and retract and administer the other 50%, and then take the needle away. We've marked the patient's skin on the common extensor origin. Now it's important to clean the area thoroughly. And then, sharp scratch. We go in at 45 degrees to the point, in, and as we retract a little, we bring it round and administer 50% of the drug. Then we take it round through the arc and in, and as we retract, we put the other 50% in and finish. Close it. Once we've finished, we want to flex and extend the elbow 5 times slowly. 2, 3, 4, 5, and then rotate into pro and supination as well 5 times. And then we would follow up with the appropriate advice and exercise to follow up with this patient. What we're going to do now is some rehabilitation exercise for Tony's tennis elbow. What we're going to do is an eccentric strengthening program using a TheraBar. And what I want you to do, Tony, is do 3 sets of 15 repetitions a day. Starting off, I want you to bring your affected arm into wrist extension. So pull your hand back towards you, that's good. And maintain that position. And now I want you to twist your left hand forward on the bar. Okay, rotate it around, that's great. And then holding that position, I want you now to slowly release your right hand. Good. And then roll both back together, back into extension. And then again, load with the left hand by twisting and rotating forward, and then slowly release with the right hand. So you're slowly releasing with the resistance, and then bring back into extension. And that's what you'd keep repeating.